Work and my postdoctoral work have both been funded from Rotary, so it's had a huge impact in shaping my career and allowing me to be in the field that I really am interested in continuing to work in a field that I think is really important. So I couldn't be more grateful for the support that Rotary and the entire community have provided for me and provided for mental health research in general. So yeah, it's massive.
Funding is absolutely critical, and again, I'd like to thank all the Rotarians and all the people who have put money in that has supported this and other mental health research. Because as much as we would like to, we can't do it without funding, and particularly funding at critical periods. And the critical period for this was those early years when we were recruiting the woman and the early engagement, and also in the, as I said, things like the in-depth interviews that we gave, which really require a lot of person time, and that person needs to be funded for that person time to do those sort of very detailed interviews. And I must say that overall, funding is very less or little in Australia for eating disorders and for mental health compared to the grants and things that are available internationally in Europe and in North America. And I would say we do research often in Australia on the smell of an oily rag. What we produce, what we're able to do, I think is, I'm really just talking about my colleagues here and other researchers across Australia, the impact that they've managed to have with much smaller size funding grants than may be seen internationally. So we are very, very grateful for that and for that support. Can't say it enough, really.
In thinking about the first point, it's been an amazing impact on my career to have support from Australian Rotary Health for my research. And I think one of the reasons, not just supporting me personally in being able to develop my career, but one of the reasons it's so important to have mental health research funded is that there's then continuity in research. I said earlier that research gains are pretty incremental, but if you're able to continue your research focus, you can build on those gains in a really meaningful way rather than being a bit choppy and stop-start. If you can have a continued focus on a topic, I think you're really able to strengthen what you can understand from that topic. And that's really fundamental to the research of researching mental health, but also in being able to then improve the mental health of Australians through this research. And opportunities to do really meaningful work and have that funded are not very common in the Australian context. And I don't know how well Rotarians understand the place that Australian Rotary Health has in mental health research funding. It's really extremely well known and central to the funding landscape, and so appreciated by researchers that we have opportunities to conduct our research